Hi, I'm Dr.Behnaz, Pelvic Floor Specialist. So many people come to me saying, I've been told I have IBS, but no one explained why it makes my pelvis hurt too. That's what I want to talk about today, how your gut and your pelvic floor are connected, why IBS can cause pelvic pain, and what you can do to feel better. IBS stands for irritable bowel syndrome. It's a condition where the bowel becomes extra sensitive and doesn't always move the way it should. Some days you might be constipated, other days you might have urgency or diarrhea. Often there's bloating, cramping, and gas. Now, here's the important part. Your bowel sits right above your pelvic floor muscles. So, when the bowel is irritated, swollen, or sluggish, it directly affects your pelvis. Why IBS creates pelvic pain? Think of your pelvic floor like a hammock at the bottom of your belly. It's supposed to gently support your organs. But with IBS, when you're bloated, the bowel presses down on that hammock. When you're constipated, the pelvic floor strains against the pressure. When you're rushing with urgency, the muscles tense up in protection. Over time, the pelvic floor stays tight. We call that guarding, and guarding causes pain with sitting, intimacy, bowel movements, and even daily activities. Many patients tell me, whenever my stomach flares, my pelvic pain flares too. That's the gut pelvis connection. Whenever IBS is affecting your pelvic floor, you might feel a deep ache or heaviness in the pelvis, pain when you try to have a bowel movement, constipation that feels incomplete, urgency and bathroom rushes, pain with intimacy or bloating that makes your pelvic pain worse. Now let's talk about what can help. Food is one of the biggest influences on IBS, but here's the tricky part. Everyone's body responds differently. That's why I recommend keeping a food and symptom journal. Write down what you eat and note when bloating, constipation, or urgency appear. Over time, patterns show up. Maybe coffee always makes you rush to the bathroom. Maybe dairy leaves you bloated. Maybe high fat meals slow your system and cause constipation. Common food triggers include caffeine, artificial sweeteners, greasy meals, dairy, wheat, and highly processed foods. Hydration is also critical. When you don't drink enough water, stool becomes hard and constipation gets worse. Constipation puts pressure on the pelvic floor and increases pain. Sipping water throughout the day, not just chugging at once, keeps things moving. Fiber plays a role too. The key is balance. Too little fiber can worsen the constipation, and too much fiber can cause bloating. The best approach is gradual, adding fruits, vegetables, and whole foods slowly so your gut can adjust. So, about your toilet posture, how you sit on the toilet really matters. Place a small footstool under the feet so your knees are higher than your hips. Lean forward, rest your elbows on your knees, and breathe out instead of straining. The other thing that I want you to know it's about abdominal massage. Gentle clockwise belly massage follows the path of the colon, can help move gas and stool through. Many people find this useful in the morning or during bloating episodes. You should also know that stress is one of the triggers of IBS. So I want you to try diaphragmatic breathing to relax pelvic floor muscles. So, and also stretches like child's pose, trunk rotations, or happy baby position can release pelvic tension and ease bloating discomfort. You should know that your body loves rhythm. Try setting aside a calm time each day, often after meals, to go to the bathroom without rushing. Training your bowel to a routine helps reduce urgency and constipation cycles. IBS flares with stress. Tools like packs on the belly, guided relaxation, or even short walks after meal can calm the nervous system, quiet the gut, and ease pelvic pain. If you have IBS, you need to know that the pelvic floor doesn't need to be stronger. It needs to learn how to let go. Gentle therapy techniques, awareness training, and relaxation exercises teach the muscles to release instead of guard. Okay, let me bring you a real life example. One of my patients had lived with IBS for years. She noticed flare ups every time she had ice cream or a second cup of coffee, but she never connected it to her pelvic pain. Once she started a food journal, adjusted her diet slowly, added belly massage, and learned the right way to sit on the toilet, she said, for the first time, I don't dread going to the bathroom. I feel like I can manage my flares instead of being controlled by them. IBS doesn't just affect your stomach, it affects your pelvic floor too. But the good news is you can calm both by paying attention to the diet and hydration, using the right toilet posture, practicing belly massage, breathing, stretching, and pelvic floor relaxation. You can take control of your symptoms and feel more comfortable in daily life. If this video helped you, please subscribe, like, and turn on the notification bell so you don't miss my next pelvic health video.